Good afternoon, good evening, colleagues, and welcome to this, our latest ICN webinar. We're particularly delighted to be able to welcome very special guests and friends from the International Labour Organization who are joining us for our session today. I will say a little bit more about the session shortly, but just in terms of some of the housekeeping issues, colleagues, this webinar translation is available in English and in French and in Spanish. We will be using the Q&A and the chat functions at the bottom of the screen. So for questions, please use Q&A. For chat, for comment, for observations, please use that. We record our webinars and we collect everything from the Q&A and from the chat functions as well. Colleagues, before we start on the focus of our webinar today, I'm sure all of us have been watching developments in India and the challenges that the health systems and our nursing colleagues and healthcare workers are facing there. And I'm going to pass in a moment to the ICN president to say a few words, but I do want to acknowledge that we do have some colleagues from India who are on our webinar, in particular Dr. Dilip Kumar, who is the president of the Indian Nursing Council, who has been able to join us. Dilip, it's good to see you. But without further ado, let me now please hand over, Madam President, to you. Annette Kennedy, the floor is yours.
Thank you, Howard. Good morning, good afternoon, good evening, everyone, wherever you are. Thank you for attending this very important webinar. We're holding it, ICN is holding it because of the shortage of nurses, because we're facing into the future with our very good friends and colleagues from the International Labour Organization. I know Howard will introduce you all, but just to say, Alette, it's very good of you to take the time, from Christiana and Sikit and Christine to Pedro and to Anne. Thank you so much for coming on board. And to Jim, thank you too. In terms of today, I'd first of all like to say that on behalf of all of us and on behalf of all the nurses worldwide, we want to express our deep sympathy and our solidarity with the nurses in India. And Dr. Dilip, I'm glad you could come, but I'm so sorry to see what is happening throughout the whole week in terms of our colleagues in India and the lack of resources and the lack of oxygen, the lack of beds. It is so difficult. It could happen in any country with the way COVID is. And we have to show our deep sympathy and our solidarity. And we will be releasing a statement. We will be writing to you, Dr. Kumar, in the International Nursing Council, and to express our solidarity with all your nurses in India. And I know that I echo the sentiments of everybody here today and everybody listening on. It is just so hard to watch. I would also like to say that there are some Indian nurses on this webinar, but also I would like to say to all the nurses that have come to all our countries throughout the world to help us, I'm sure it is very difficult for them to watch what is happening and to know that they have friends and colleagues in India at this very time. So my sympathy to them and to thank them for being with us in different countries throughout the world. They have given us such great support and they have helped us and helped every country. And I know even from my own country, there are so many nursing colleagues in Ireland working very hard, and it is very difficult at this time for them. And it could be any country, it could be any of us that are facing the same. And I'm sure Jim would echo this, that it's all about supply and demand. And if supply exceeds demand, then for resources or for workforce, we're in big trouble. And today, it's so important that we talk about planning for the future, because there will be a future, but the future will be not good if we don't have a supply. And we're faced into this COVID-19, with the shortage of nurses, we're facing with looking at retirement in the next 10 years. But what we don't know is the number of nurses that will leave the profession due to COVID and due to their experience of COVID and due to their physical and mental trauma. And I think more than anything else, I worry about them. I worry about their mental health. And I think that if we want to retain them, if we want to retain that knowledge base, we have to support them. Every one of us have to support them. We can't look to governments to support them. We have to do it ourselves. So I'm very anxious to hear from both our colleagues in the International Labour Organization and from our own colleagues about our ideas for looking at a workforce that's unemployed and seeing if we can manage to bring them into the health workforce. You know, we have to have new initiatives. We have to have ways of dealing with our workforce shortage, and we have to come up with the ideas. So today is about collectively looking to the future. Thank you, Howard, and I'll hand back to you.
Thank you, Madam President, and I have no doubt that your words of solidarity and support are shared unanimously by everybody who is on this call, and I know, Dilip, that many of our associations have also told us that they are actively encouraging their countries to do as much as they possibly can to provide support to India and to the people of India. Colleagues, before we start as well, I just also wanted to let you know that we do have some colleagues with Myanmar who have also joined us. Myanmar has isn't in, perhaps slipped off the news agenda a little bit, but I think people who know the country and know the region will know that the situation continues to be incredibly challenging in that country as well. We're in contact with colleagues in Myanmar who are continuing to provide healthcare, health services to the people of that country, and our support and solidarity is with them, and we maintain regular communication with nurses, with the health workers in Myanmar as well. Colleagues, we're going to now move on to the focus of our webinar. As I said, we are delighted that colleagues from the International Labour Organization are our guests and are going to be participating in some of the panels. But I'm particularly pleased to be able to welcome Alette van Leur, who is the Director of the Sectoral Policies Department at ILO. And Alette, I would like to pass the floor to you for some opening remarks. Over to you, Alette.
Thank you so much, Howard. Dear Annette, dear Howard, dear colleagues, please allow me to take this opportunity to express my deep respect for nurses and their daily work in providing care. Nurses all around the world attend to people in vulnerable health situations and provide critical services for public health. I would also like to echo the words of solidarity and appreciation for the Indian healthcare workers, but also for the situation in Myanmar. The COVID-19 pandemic has reminded us again of the importance of health and care workers to societies, in particular nurses, who are the biggest occupational group within the health workforce. 2021 has been named the Year of the Health and Care Workers by the WHO. Health workers are sometimes referred to as heroes, relentlessly providing care while risking their own lives. And I'm aware that some health workers do not like to be called heroes, but instead want to just get more support. COVID-19 has once more revealed the difficult conditions of work, aggravated further by persisting health workforce shortages in chronically underfunded public health and care systems. It is clear that applause or even a heroic status is not enough. Bold and sustainable investments are needed to ensure decent work for the health workforce. I would like to thank ICN for inviting the ILO, to participate in this webinar. And I'm happy to see that there are a couple of colleagues, very knowledgeable colleagues online, who will provide further inputs to your ICN webinar. It's very timely to now discuss initiatives for building back better, as we call it, building back better from COVID-19 towards a human-centered future of work for all. And that applies particularly for health workers. We also invite you to add your voice and your perspective to the general survey on the Nursing Personnel Convention, number 149, which is currently ongoing, and colleagues are online to discuss that further later. And strangely enough, Convention 149 is actually the only international labor standards targeting the health workforce. I have to say it's with regret that I have to announce that I cannot stay with you throughout this webinar. We have a sectoral meeting ongoing at the moment for seafarers in the ILO that I need to attend to, but I really look forward to receiving the results of your discussion and to also continue our long-standing collaboration with ICN, and all of that we fight for the same purpose, and that is to advance decent work for nursing personnel. I wish you all the best for this webinar. Thank you very much.
Alette, thank you, and thank you for finding the time. As you say, it's been there's been a long-standing relationship between our organisations, and absolutely we will not only be sharing the details of this webinar, but looking forward to continuing to work very closely with you over the coming weeks and months. Thank you, Alette. As I said, colleagues, we're going to cover two issues in this webinar. We're going to firstly, for the first half of the webinar, address and consider shortages, nursing and healthcare workforce shortages. And then we're going to go on in the second part of the webinar to specifically consider the ILO Nursing Personnel Convention. I'm going to moderate you through the first half, and then I'm going to hand you over to Christiana Wischau, who has been a tremendous support and link and advisor with ICN over a number of years, and Christiana will take us, moderate us through the Nursing Personnel Convention discussion. As I was preparing for the webinar, colleagues, what caught my eye very clearly at the end of last week was WHO's latest survey of countries in relation to the disruption of health services as a result of COVID. The standout finding from that survey that WHO released last week was that 66% of countries continue to report health workforce related reasons as the most common causes of service disruptions. I know we all know this, that when we talk about health system strengthening, the foundation stones of that are our nurses and our healthcare workers. So this discussion on shortages, I don't think could be more timely. One of the issues that ICN, of course, has been very concerned about is the significant number of nursing shortages. We have put out reports to detail the impact of the COVID pandemic on the nursing workforce, and we think that the 6 million shortage that we went into the pandemic could grow as a result of aging, could grow as a result of people leaving the workforce early because of their COVID experience. It could perhaps even be up to 12 or 13 million. It's a huge, huge number. But we don't want to just talk about the shortage, we want to find a solution to it. And I think what we all see are other sectors of our economies, in retail, in transport, in hospitality, where jobs are being lost. And something that ICN has floated as an idea, as a concept, is how we might support people in sectors that are losing jobs to move across over into health employment. And our first speaker is ICN's Senior Advisor for Nursing, Erica Burton, who's going to talk and share with us a little bit more about ICN's thinking in relation to how we might address shortages. Erica, the floor is yours.
Thanks so much, Howard. So at this point, I want to give you a little overview of what is a hero fund, or the solution that we're proposing to these shortages. So ICN put a press release out at the beginning of December where we first proposed this idea of a hero fund. So kick off the discussion with this brief overview of the concept, why ICN has proposed these hero funds and what they could achieve. As we all know, the COVID-19 pandemic has resulted in unprecedented reductions in working hours. These have led to massive spikes in unemployment. So in 2020, the equivalent of 255 million full-time jobs were lost, and million more losses are expected in 2021. The hardest hit sectors, as Howard mentioned a few, are retail, accommodation, food services, and arts and culture. And these job losses have disproportionately affected certain groups. So women, younger folks were affected. They were already vulnerable. These groups tend to earn less and have higher job insecurity, and they're less likely to have access to these social protections and more likely to be close to poverty. At the same time, we were anticipating that the world was going to see these nursing shortages. At this point, you've heard ICN describe that we're going to need to replace around 13 million nurses by 2030. This shortfall is a result of existing nursing shortages, of aging populations, of changing healthcare needs, and then what we're also calling the COVID-19 effect. The pandemic has put the nursing workforce under, as you all know, immense pressure. So in a recent ICN survey, we found that 90% of national nursing associations who were surveyed have concerns that the heavy workloads, the insufficient resources, the burnout, the stress are all causing nurses to potentially leave the profession. And about 1 in 5 of these national nursing associations report an increase already in the number of nurses leaving. And these shortages, not just for shortages' sake, they will absolutely weaken the nursing workforce to a point where health systems are severely affected and their ability to provide these needed services are severely affected. We could actually see our progress towards universal health coverage in some countries be reversed, and the world not being able to meet the Sustainable Development Goals by 2030. So in response to this, rising global unemployment rates on one hand and health workforce shortages on the other, ICN is proposing what we're calling hero funds. HERO stands for Health, Education, and Retraining Opportunity Funds, or HERO funds. So this would be dedicated funding that would increase the capacity of the education sector to educate more nurses, more healthcare workers, and support at the same time individuals who have lost their jobs to transition into the health workforce. And so we think that training people who have lost their jobs in other sectors during the COVID-19 pandemic would offset both the loss of jobs in some sectors and also the health workforce shortages that the world is facing. The health and social sectors offer a unique opportunity for large and steady growth in decent work, particularly in the face of growing job losses in other economic sectors. It would also have this added effect of contributing to things like progress in gender equality, and then of course, in health and well-being. In 2016, the UN Commission on Health, Employment, and Economic Growth made a very strong argument that spending in health and spending in education is not a cost, but it's actually an investment, and that this investment directly contributes to inclusive economic growth and development. And from this, the Commission put forward a set of recommendations to strengthen health and social protection systems. One of these recommendations is that countries scale up transformative, high-quality healthcare worker education, and that they raise adequate funding to invest in the right skills, decent working conditions, and appropriate number of healthcare workers. And then in the following year, the ILO, OECD, and WHO joined forces to develop what you'll hear about shortly is the 5-year action plan for health employment and inclusive economic growth. And this supports and facilitates country-driven, so member state-driven, effective implementation of the UN Commission's recommendations. They made about 10 of them. And so this 5-year plan sets out a number of deliverables on the Commission's recommendation. And establishing these hero funds would be a concrete action that countries could take in line with this plan. So for example, hero funds would be a commitment to adequate budgetary resources for investments in transformative education at the national level, which is one of the deliverables of the 5-year plan. These funds would also contribute to the resources needed to deliver high quality education to grow this well-distributed and appropriate skilled health and care workforce, nursing, and in other cadres of healthcare workers. And we see hero funds as being channeled into supporting factors that affect not only the numbers, but also the quality of health worker education. So it's not just about enrollment numbers, it's really looking at funding these pieces that lead to high quality education. Some of these factors could be adequate number of qualified faculty, infrastructure and capacity for clinical education, which we've seen has taken quite a big hit during the pandemic, accessible tuition, flexible payment options and loan systems, and then living expenses. So things like subsidies for childcare, which are all really important for learners as well. It's also important to note that this requires coordinated and collaborative action across a few sectors. So across health, education, social, labor, and finance sectors. And that is absolutely essential for these funds to be effective. ICN is recommending that these funds be distributed on a needs basis. So to do so, ministries should apply a labor market approach, and that would include an analysis of the distribution already of health worker cadres across the workforce in countries and across geographical locations, so that these funds are distributed really based on need. And then lastly, we think that hero funds could have the potential to mobilize major donor investments and reduce spending on unemployment that countries are having to spend as a result of these massive spikes. So with that, I will hand back over to Howard, and he can introduce the next speaker who will dive into this concept a little bit deeper. Thank you.
Erica, thank you very much. Erica mentioned the Working for Health initiative. Christiana Wischkau, who I've already introduced, but a pleasure to welcome you again and to introduce you to speak a little bit more about the ILO, OECD, WHO Working for Health initiative. Christiana, the floor is yours.
Thank you very much, and I'm happy to say that Erica did most of my job. So she presented the background of the Commission for the Working for Health program. So let me save some time here and simply report to you that in partnership with WHO and OECD, ILO is working actively on the Working for Health program, and the idea is exactly from the start to look beyond the health sector and seek for labor market-based approaches that involve multi-sectoral stakeholders, because the health workforce shortage issues cannot be solved within the Ministry of Health alone. But we need a couple of other ministries, the Ministries of Finance, and education, and labor employment strategies. So currently the Working for Health program is in the implementation phase, and the 3 organizations are assisting countries in implementing the recommendations of the High-Level Commission on Health Employment and Economic Growth. And we are currently providing assistance to 12 countries. and have two global products. One is the International Platform on Health Worker Mobility, where global guidance and policy meetings are taking place. And the other one is the interagency data exchange, because we think that so many data sources provide health workforce data, and it would be good to see how we can consolidate these data. Not that we want to harmonize everything into one database, that is simply not possible, because these are different sources, but to provide guidance on which data can be used best for which purpose and where you find data. So this is the aim of the interagency data exchange. The program also implemented two programs, or is still there at a regional level. That means providing guidance to two sub-regional economic unions. One is the West African Economic and Monetary Union, UEMOA, and the other one is the South African Development Community. And those have both adopted now regional health workforce strategies that provide guidance to countries, to their member countries, on how to improve the health workforce strategies. We have created at the beginning of this work what we call a multi-partner trust fund, so that donors can provide their support into one fund, and from that all the work is financed, and we are being governed by a steering committee that meets regularly, both content-wise and strategy-wise. The 5-year action plan will be up for discussion at the World Health Assembly, as you may know, and we look very much forward to hopefully getting the mandate to extend the fund work and the Working for Health program, because everybody is in consensus that the health workforce agenda is so relevant, and even more relevant than ever. I stop here, Howard. Thank you.
Christiana, really very, very helpful. Thank you for that. So, colleagues, you've heard what the concept is, and a lot of people might say, well, that's a nice idea. We start to get into the technicality, the complexity of this, of how we pull people together, how we create the funds, and Christiana has shared a light into how we might do that. But as we move into the real brass tacks of this, how do we go about planning the workforce, and what are the issues for education, for nursing education? And we're going to try and address and unpick those a little bit more now. Firstly, a very good friend and colleague of ICN, Professor James Buchan, and also recognised global health workforce expert. Jim, thank you very much for joining us. Give your thoughts and perspectives on the Hero Fund from a workforce planning perspective.
Many thanks, Howard. Good morning, good afternoon, good evening, everyone. I've got 5 minutes, which is a bit of a challenge in itself to try and cover everything that workforce planning includes, but I'm going to go through this at pace, but try and pick up on the main issues. Context, to reinforce what Howard has already mentioned. Last week, WHO update on COVID impact, 2/3 of countries identifying workforce shortages as the major continuing disruption. If we look at that COVID context and we reflect back on the report on the state of the world's nursing, which came out early last year and essentially presented the pre-COVID picture of the world, we were already in significant problems in terms of millions of nurses short across the globe, particularly in low-income countries. And something like another 4.5–5 million nurses getting into the age groups that they're going to be retiring sometime between now and the end of the decade. those retirements often happening in high-income countries. So there's a dynamic there of the likelihood of increased mobility across the globe, with nurses moving where the shortages are pronounced, but where countries can most afford to pay more. I'm just using one slide here, and what I want to try and do is pick up on that backdrop of workforce planning, but also get beyond the recognition that it's about numbers. And really what we're talking about here is about individuals who are in the workforce or who could be in the workforce over the next few years, and look at what that means in terms of specific areas of policy intervention. My starting point is a concern I have. I keep hearing about nurses and other health workers demonstrating great resilience when they're faced with the challenges of COVID. That risks putting the challenges of dealing with COVID on the individuals, and that is grossly unfair. And this is a scale of a challenge that can only be met through system responses and through coordinated responses between countries and international organizations. And if we then look at what that means in terms of workforce planning in the broadest sense and focus the potential of hero funds within that area, I think there are, obviously in terms of the hero focus, it's primarily going to be on recruitment, the first point I've got there. We are going to have to look at replacing some of the current workforce. That is inevitable, partly through the but also recognition that some health workers in countries, unfortunately, will be burnt out. They will be looking to retire early or move out of work. So there's a replacement challenge there, which we can, in part at least, look at addressing through the potential to retrain and repurpose workers from other sectors who can, with some retraining, depending on the type of worker and where we're going to focus them, and broader repurposing. And I think the extent to which that potential for retraining exists in different countries is often underestimated at the moment. The UN High-Level Commission gave us some indications and directions. And I think what's now happened is that COVID has accelerated and exposed the extent to which there are both shortages in some areas and the potential for retraining coming from others. So I think there's fantastic opportunities through operationalizing the hero funds. But I also think that in the overall approach to workforce planning, we must also equally consider what we need to do and can do to continue to retain nurses and other health workers who are currently in the system. I've managed to use R for every intervention that I've suggested, which works in English. It may not work in others, but it's an easy way of thinking through what the various options are. I think in one case, we're going to be looking at health workers, nurses and others who are burnt out, and we need to be looking at potential for providing them with some respite from being at the front line in the big challenges. That can perhaps also be secured through looking at structured rotation of workers from high intensity areas to less intensity areas. And also looking at redeployment where there is a need for workers to move to less challenging areas because they are perhaps burnt out. So my overall point here is that workforce planning is about numbers, and we need to look at supply and demand. We need to look at recruitment and retention, but we mustn't lose sight that at the core here, we're looking at many individuals who've had the most challenging year of their career ever. And we need to look at what we can do to support and encourage them to maintain connections with health employment where that's feasible. And beyond that, we need to be looking at the potential for retraining and repurposing of health workers and workers from other sectors of the economy. And the big challenges there are not just about planning, but they're also going to be about the response of the education sector and what types of new bridging courses, for example, we can find. I'm going to call a halt there. That's my 5 minutes, and I look forward to contributing further across the sessions. Thank you.
Jim, thank you so much, and for also very neatly leading us into our next contribution. So we like the idea. It's a question about the money. Jim set out what some of the planning issues are, but has clearly described that the education offer might be quite wide-ranging given the folks who we might be wanting to support and the situations that they are in. So we now want to focus more specifically on what this concept means for nursing education. And the ICN First Vice President, Pam Cipriano, is also the Dean, the Nursing School at the University of Virginia. So Pam, your expertise on this couldn't be better. Thank you for your time, and over to you, Pam.
Thank you very much. And hello, everyone from the United States this morning, wherever you are, afternoon and evening. As you've just heard Jim talk very eloquently about, there is a lot on the planning side. And I like to think of education and workforce for healthcare as part of a bigger ecosystem. We have this mutual dependence. We cannot create the workforce without our educational institutions. And this is both for the short-term issues of shortage as well as the long-term. We know, as you've heard from Erica, millions of workers have lost their jobs as a result of the COVID pandemic, many of these being the lower income individuals, younger workers, women, and many of them have minimal training or education to help them access their next opportunity. So that's one of the beauties of the concept of saying we must come together collectively to figure out how do we fund educational programs that will help us not only now, but into the future as we think about this larger healthcare workforce. We know that the healthcare workers certainly are really being looked to help achieve the Sustainable Development Goals and universal health coverage. So that was the pre-pandemic concern as we looked at the enormous shortage of nurses. And now we're looking at an entire array of jobs. On the other hand, we also know that healthcare is masterful at creating new jobs, even in the midst of financial crises. But what's unique about the potential to bring together individuals who want to create funding, such as has been proposed through the HERO Fund, is that this is a real novel approach to invest in education of skilled health and care workers to support entry level or what we might want to call foundational positions. And so we want to be able to have those individuals who have an interest and have the ability to learn and take on new jobs and new skills to be able to have the ability to do that. Many of these individuals have been financially challenged, so they don't have the personal means in order to be able to pursue education at this time. We also know that the health sector will consistently lead other aspects of the economy in many of our countries, beginning to recognize even more that healthy people are good for the economy. So an investment in health, an investment in a health workforce actually pays off, pays dividends long-term for most countries. And again, one of the unique areas of focus, and you heard Jim speak to this, is the retraining. This is one of the R's that we're really looking at. How do we enable a major sector of individuals that can be very productive workers to be able to not only stem some of the shortage issues, but begin to create a pipeline that goes longitudinally for people to start or come into these foundational jobs and then progress to perhaps pursuing nursing careers. We know from the State of the World's Nursing Report last year that, again, there are educational prerequisites that are required that many individuals lack, and so it's difficult for them initially to pursue nursing education programs in the formal sense. But we want to be able to create more qualified individuals that can be on that pathway, that can be on that pipeline in order to shore up the overall nursing workforce. So we want to be able to have individuals that can feed the future RN population in all of our countries. So the Hero Fund has many opportunities that we can look at through partnerships, public-private partnerships with businesses, to look at government-sponsored programs with educational institutions that will do this reskilling, that will be able to, again, help individuals move into higher paying jobs. We want to be able to provide the scholarships and supports, particularly for those who are in a position for retraining, to make sure that they are not economically disadvantaged to move forward at this time. Many countries have found that investing in their early education systems, from their kindergarten to 12th grade or pre-college ages, that to be able to expose individuals to health careers is one way to position them. So again, even though we are very focused on the displaced COVID worker right now, we also know that many of these approaches can provide foundational money to be able to begin to rebuild that overall pipeline, because this is not just a current COVID problem. This is a long-term problem that we have struggled with in the nursing workforce. And then we might want to look at creating programs that have a give back aspect as well. This has been popular in many countries, that in exchange for education, there is a commitment to that workforce. So we really encourage all sectors to come together to collaborate, to provide the investment and commitment to growing the workforce. And we know that as we look at this collaboration that we have with ILO and other groups, that this is a wonderful model to be followed as we go out to our government and foundation partners to look at how we can actually fill the coffers of the Hero Fund.
Pam, thanks so much for that. And I think really important to hear that in a way, this is already on the agenda of education, as Pam has described how when nurse educators are thinking about the development of nursing education, the position of nursing education within economies and sectors, and the relationships and partnerships with others. It's very much part of those strategic discussions that nursing education is having. But Pam also made it very, very clear, and it picked up from what Jim said as well, that this is thinking about lifelong learning, and it's thinking about skills and employer and employment as well, which is a nice segue to take us back to colleagues from ILO, who are going to say a little bit more about this concept from those perspectives. We're joined by Pedro Moreno de Fonseca, who's a technical specialist on lifelong learning at ILO, and Christine Hoffman, who's a specialist on skills and employability as well. Thank you both for joining us, and Pedro, the floor is yours.
Well, thank you, Howard. It is a great honor to be in this ICN webinar, especially during this period, which has so clearly shown demonstrated the importance of the nursing profession. And I'm here to talk a little bit more about these skills solutions that can be applied to boost the supply of skills and of qualified professionals in this area, in this sector, in this specific sector. What I would do is just to call attention on, let's say, 5 potential issues for reflection and for fund investment too. The first being the potential of a short-term response based on labor migration. So this is one dimension which can be explored. Normally what happens is that there can be established bilateral labor agreements between countries to facilitate the circulation of healthcare professionals. One other possibility is the establishment of public and private partnerships under the Global Skills Partnerships, which my colleague Christine has been following. So if there are some questions, she may also follow up a bit on this matter. But fundamentally, looking into this situation also implies that countries must look into the development of mutual systems for recognition of skills and qualifications, to enable the circulation of professionals. Bearing in mind that frequently this circulation constitutes a movement of professionals from low and medium income countries to higher income countries, it is important to find solutions on this level which create equitable outcomes for all countries, and also to ensure that if there is a circulation of this type, that healthcare professionals can find good work conditions and appropriate integration in the host countries. A second point I would like to focus on is what has been already a bit mentioned, which is about the retraining, so the reskilling or upskilling of available workforce. Once again, we need to reflect a bit about the need to invest in systems for the recognition of prior learning. If we are to think about retraining or upskilling workforce which has a different work experience. So I'm led to think that primarily people who have developed sets of skills which are used in healthcare services should be targets for this type of investment. And I'm thinking, for example, about caretakers, and eventually be informed about pathways to qualification. Thinking about pathways, probably in many countries there needs to be enabled a discussion on the access to flexible pathways to qualification, especially bearing in mind that these are highly regulated professions in general. So it is important to understand if there are differentiated roles and differentiated learning pathways which can lead to these roles. So let's say roles with higher or lower levels of skills and qualifications. So for example, thinking about the development of apprenticeships is an hypothesis. Of course, in this case, the role of associations and trade unions is, of course, going to be fundamental also to help develop this process. A third point, which was also mentioned already in some of the let's say the little discussions that were held here, is the promotion of incentive schemes to training and to learning. And on that level, we're talking about creating scholarships, providing grants, subsidies, loans. Of course, these are all valid instruments which can be used. And of course, they should primarily be based on good targeting, so a good assessment of the needs of the services of the market, but also there needs to be some care when defining these incentives so that they do not promote dead weight loss, being that a lot of people would have already gone into the profession anyway and tried to access training anyway. The fourth point of reflection, aiming at medium and longer term solutions, is investing in career guidance. People need to be informed about the fact that nursing is becoming a bottleneck profession, and which can provide actually access to a good socioeconomic status, has good labor market outcomes, and people also need to be aware about the potential pathways to acquire qualification and join the profession. This implies to have an investment of this information, not only with the people who have lost employment, who suffer the layoffs, but also to have an investment with youth in education and training, and also to develop outreach initiatives near professionals which could eventually be retrained or upskilled to be part of the nursing labor force. One important aspect is also, especially in certain countries, to fight gender stereotypes which might be associated with the profession, to encourage the uptake of training in this area by both genders. Finally, one fifth point has to do with the fact that there is an aging workforce. So as it was mentioned, there are several aspects which can be studied. One is the redeployment of people in different roles, as it has been mentioned. So, for example, physically less demanding roles for, let's say, the older workers. Another hypothesis is to study the expansion of part-time work within the sector, which can also be associated with the flexibility of social protection arrangements by, for example, stimulating the development of partial retirement schemes to encourage the uptake of part-time. So this is a parallel discussion, but also important. And finally, also, we must bear in mind that there needs to be work on the, I say, work-life balance component to retain an older workforce. So we should also look into a type of holistic support to the existing workforce to enable the prolongation of the working life. So I'll leave it at that at this point. Thank you.
Pedro, thanks you so much for those 5 really key points. Christine, was there anything that you wanted to add or to bring into the discussion from the skills and employability perspective? Christine, over to you.
Thanks a lot, Howard. I mean, Pedro has really mentioned the key points. One aspect that hasn't been mentioned a lot, but I think it clearly also deserves attention is retention, and how investments in skilling is always, and in retraining is always the second option. So the sector is facing the challenge that the current workforce drops out. So probably devoting some thinking on retention as part of the Hero Fund would be useful, I think. And depending on the country context, I mean, I've taken a look at your concept note, and it seems to still be very flexible as to different country institutional setups. So we do have training funds in some countries, and I think it would be really important to see how the new fund links to those existing institutional mechanisms, not to reinvent the wheel overall. Yeah, and I stop here. I'm very happy to respond to questions if there are any. Thanks.
Christine, thank you very much. Colleagues, just to let you know that we are developing this concept into a paper, and we're using this webinar and the contributions that you've heard from, and also your comments in your chat as well, and your thoughts. Please keep those coming in as well to shape an ICN paper that we will hope to publish very soon. Colleagues, I haven't got time to go for lots of questions, but there's one contribution that I want to take. We have Phil Nisheha, who is the General Secretary, Chief Executive of the Irish Nurses Midwives Organisation, who is thinking a lot about these issues of shortages and capacity within the nursing workforce from the perspective of a very influential association in Ireland. Phil, in terms of your situation in Ireland, but also this discussion that you've heard as well, what are your thoughts? Phil, over to you.
Thanks, Howard, and good morning, everybody. Good afternoon, everybody from Ireland. I think this is a really important discussion. I think it's very timely, and I think that we have to have very strong recommendations, otherwise governments will make the wrong decisions. I see a push for using the health service, which is under-resourced, to most certainly look to be the assistant in the unemployment question, which is going to develop. I don't believe that unemployment and health workforce is the same thing. I think we have to think far broader. And I think from nursing and midwifery perspective, we have to look at the defining of the roles and making sure that we do not end up with tasks that are siloed off into little training programs that people can do. And then we have a mismatch of care, which we have, I think, as nursing organizations, strongly argued against for decades. So I think that the Hero Fund must look at retention as the central point. And I really agree with what Pedro has said in respect of part-time and partial retirement. We have a very small scheme in Ireland, which we fought for, and as part of a strike settlement, it was introduced to allow nurses continue at work but retain their full pension benefits. Very small uptake, because obviously many nurses don't get their pension benefit until they're permanent, and didn't. We have being too old and too tired to continue, and pension poverty. Those two pieces, I think, are not unique to Ireland. I think that is a similar situation across the globe. I think we have to look at how do we promote nurses and their skill set to be of benefit in the longer term. When we talk about retirement and prediction retirement, that's a gross underestimation, because that's based on the normal retirement age. In my experience, many nurses retire early because they simply cannot continue. The bottleneck principle is very real. In Ireland, we have I looked at the employment figure, 40,000 whole-time equivalent nurses in the public sector. Just over 30,000 of them are at the staff nurse grade. So we need to look at not just incentives for entry into the profession, we also need to look at opportunities to specialize, to advance your practice, and to support differently. Finally, the apprenticeship idea, at the moment, the Irish government have introduced an apprenticeship model for healthcare assistants. And this is a 2-year program, and there is going to be funding made available to increase healthcare assistant apprenticeship training in the public sector. And that is a paid program. And in the meantime, student nurses will be unpaid while training for a longer period. So, you know, we have no difficulty, I think, in arguing that the day of unpaid students, we know what this pandemic showed, the reliance on unpaid students during the pandemic to provide care, very good care, and we need to tackle that issue. Having an education and getting an honours degree does not have to be unpaid, shouldn't be, and we should argue that it must be paid in order to attract and to retain. Thanks very much, Howard.
Phil, excellent, and a critical reminder of some of the very, very practical issues that we face on the ground in terms of supporting the retention of staff as well. Colleagues, as I said, we are going to be collecting all of the thoughts, the views, the contributions that we've heard into a paper that we're developing and we'll be publishing soon. I wish we had more time, but we don't, and I've run over a little bit already on this panel, I'm afraid. So Christiana, my apologies for taking a little bit longer than I should have done, but I think that the contributions were incredibly rich. But equally important, Christiana, over to you and to focus our discussion on the Nursing Personnel Convention. The floor is yours.
So I should unmute. After all these years of webinars, I should be able to unmute from the start. Sorry for that. Thank you very much. This is a very engaging discussion. And if you allow, Anna and colleagues, I would like to refer to one question in the chat I saw, remarking that there has been an increase of violence and harassment against health workers, nurses in particular. We have observed that with great concern. And there was a question to global strategies. I just want to simply inform you that the ILO in 2019 adopted a landmark, a new instrument on violence and harassment at work, and is really, and the recommendation, it's really important to promote this convention, because this provides guidance at national level, how to address these issues also at the legislative basis. So with this, we turn to the Nursing Personnel Convention that was adopted in 1977. I have discussed with many of your associations about this convention, and I'm very happy to introduce my colleague Ana Torriente, who is in charge of the general survey, and I kindly ask her to explain what is a general survey when the ILO talks about that, and give a little overview. Thank you, Ana.
Thank you very much, Christian. And thank you to the organizers, to ICN, for giving us the opportunity to be here today. And I'm very grateful to have the opportunity just to talk to you a little bit about the work that we're undertaking then this year on this general survey. Well, first of all, for those that aren't necessarily familiar with the ILO and its structure, the organization is in fact the oldest in the UN family. It's an organization that was founded in 1919, just after the end of the First World War, and its mandate is promotion of social justice and decent work. It's responsible for setting minimum standards in all aspects of the world of work, from working hours, maternity protection, social security, to protection of fundamental principles and rights at work, which include freedom of association and collective bargaining, freedom from forced and child labor and discrimination, and also specific categories of workers, such as nursing personnel. Standards in the ILO take the form of conventions, and these are essentially international treaties that become binding on countries that ratify them. The ILO works through a tripartite structure involving governments. It has 187 member states, and the national social partners, so the employers and workers organizations, and it develops and adopts conventions such as 149 through a tripartite dialogue process. It also has a well-established supervisory system dating from 1926 that monitors the application of conventions in both law and practice by countries that ratify these conventions. And since before the Second World War, the ILO has been working to advance decent working conditions for healthcare workers, including nursing personnel. And in 1977, as Christian mentioned, the ILO adopted Convention 149, focused on nursing personnel, and its recommendation 157. The recommendation contains more detailed guidance. It's not binding, but it does was adopted and adopted by the entire conference by a majority vote of all the member states at the time. It recognizes the vital importance of nursing personnel as the backbone of national public health systems, and its objective is to address the long-standing problem of personnel shortages in nursing. So, which we're still discussing today, as you see. This is not something that is a new issue, or a new concern. The convention's focus is on improving the efficiency and impact of nursing services, and thereby the public health, by improving employment and working conditions and the status of nursing personnel. Up till today, it's been ratified by 41 member states, but it's influenced national law and practice in many more, and it was developed in close collaboration with the WHO. And so, touching on the content of 149, it basically states that nursing personnel are covered by many ILO standards on employment and conditions of work, particularly the fundamental conventions on equality, freedom of association, conventions on working time, OSH protections. So even, for example, taking the example of equal remuneration, which has been an issue that we've looked at, equal remuneration in nursing between male and female nurses, although our convention, which is one of the fundamental conventions on equal pay, basically, is not mentioned, it does apply to the Nursing Personnel Convention. So I just wanted to make that clear. And it has a broad scope of coverage. It applies to all nursing personnel wherever they work. And it calls for states to establish a national policy to ensure the quantity and quality of nursing care needed to attain the highest possible level of health for the population, By requiring states to take measures to provide nursing personnel with education and training appropriate to their functions and employment and working conditions, including career prospects and remuneration that are designed to attract nurses to the profession and keep them in the profession. And it emphasizes also the need to support nurses in leadership positions, requiring that they be consulted on planning of nursing services and education, and basically on decisions that concern them. And the recommendation, which is a more detailed instrument, as I said, sets out extensive guidance on working conditions, addressing topics like excessive working hours, inconvenient hours, and shift work, access to personal protective equipment. For example, the ILO has in this year, past year and a half of COVID, received complaints, in fact, from workers' organizations about non-observance of these provisions, which is something that's going to be examined. Now, the general survey, even before the outbreak of COVID-19, in 2018, the ILO governing body asked the office to undertake a general survey on the convention and the recommendation in the context of addressing the wider topic of decent work for care economy workers in a changing economy. So with changing economy, one of the things we're going to look at is also new and emerging forms of work and what's the impact of telemedicine or other aspects. So what is the general survey? It examines the application in both law and practice of the principles established in one or more conventions, generally on a particular instrument or a particular topic. It will look at whether there are obstacles or challenges that exist to ratification of a convention, identify good practices, and make proposals. It makes findings, it makes recommendations for further action, for further promotion, implementation. And information is gathered through a questionnaire to determine if and how a country is applying the convention. And the questionnaire has been sent out to countries and it's available on our website, which I can provide in the chat if that's of interest. The timeline is kind of a funny one this time around because, of course, we were supposed to time the general survey with the year of the nurse, and then COVID happened and we had to postpone the work. So member states, everything's been postponed by a year. So member states have had until the end of February of this year to report back with responses to the questionnaire, and employers and workers have until this June, the 30th of June, to provide information. The information is going to be presented in a report that will be examined by the ILO Committee of Experts at its November-December session this year and be published early next year. The Committee of Experts is part of the ILO supervisory mechanism. As you might imagine, there's great interest in this survey. As of today's date, we've received 111 reports from governments, both in 2020 and 2021. And we, in 2020, asked for additional information, updates from countries, and that's been provided by 23 governments so far. So, because of course we're taking account of COVID, and we've received so far only the first comments from the social partners, but we hope to receive many more. The general survey and its findings in being examined by the Committee of Experts and endorsed this year present an opportunity to put forward conclusions to improve the practice of the nursing profession. And in preparing the survey, my team and I are taking into account, of course, the gender dimension of the profession, in many aspects, the impact of the migration cycle and the brain drain on nurses, and of course, the enormous impact of COVID-19, not only on working conditions of nursing personnel, but also the impacts on the physical and mental well-being of nurses in all categories, their exposure to increased risk due to the virus, also the issues of access to healthcare and social protection that they would enjoy or should enjoy as workers. We've recently spoken with workers, nursing associations in Peru that were recounting instances in which nurses have been infected with COVID and some have died and have, because of their precarious contracts, did not have access to benefits and to health care. We're looking at access to PPE, which is called for specifically in recommendation 157. And in the COVID context, Christiane already mentioned this, but we're going to be looking at incidents of discrimination, violence, and stigmatization against nursing personnel and other categories of health workers due to the very work that they do in taking care of COVID patients. So this is an area in which we are going to highlight the nature of the incidents and the relevance of the Violence and Harassment at Work Convention, which is the latest convention we've adopted. And so just to close, we're hopeful that we can benefit from hearing from you and from your organizations about your realities, your lived experiences, so that we can most accurately and comprehensively take all of the dimensions of the situation of nurses, midwives, and other nursing personnel into account to reach findings and make recommendations aimed at achieving the goals of Convention 149 of ensuring a better status, better working conditions that will attract people to the profession and motivate them to stay in order to help ensure stronger and more resilient systems for a better future of nursing. And with that, I think I apologize for speaking fast for the 7 minutes. There was a lot to cover, but thank you very much for the opportunity.
Thank you very much, Anna, and thank you for trying to give this crash course on international labor standards, general survey, and supervisory systems of the ILO within 7 minutes. I'm very grateful for that. We posted the link to the survey and the information on the chat, but please feel free to contact us if you need further information. And without further ado, because the time is running when you have fun, I give the floor to Roswitha Koch, ICN board member. She would like to reflect on ILO classifications and the quality of nursing. Thank you.
Thank you very much, Christiane. Hello to all the colleagues from all over the world. Hello to everybody from ILO. My short presentation will focus on a more technical problem, but this technical problem has big practical implications. The OECD, the Organization for Economic Cooperation and Development, is annually publishing a summary, an overview on national health systems and their performance. It's called Health at a Glance. It also includes information on the nursing workforce, and all this is based on ISCO 08 classification, which is provided by ILO. A nurse is called in ISCO number 2221, a nursing professional. I would like to read you a short definition of what a nurse is according to ICN. Nursing encompasses autonomous collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. Nursing includes the promotion of health, prevention of illness, and the care of ill, disabled, and dying people. Advocacy, promotion of a safe environment, research, participation in shaping health policy and in patient and health system management, and education are also key on nursing roles. That's the short definition. In the longer definition, there is also some content about education. The nurse is a person who has completed a program of basic generalized nursing education and is authorized by the appropriate regulatory authority to practice nursing in her country. Basic nursing education is a formally recognized program of study providing a broad and sound foundation in the behavioral, life, and nursing sciences for the general practice of nursing, for a leadership role, and for post-basic education for specialty and advanced nursing practice. That's the definition. Also, the European Union has a legal basics provision that defines clearly what the requirements are for being allowed to carry the title nurse. OECD, however, does not only include nurses in its statistics in health at a glance, but also people who would be called healthcare assistants in the EU. According to ISCO 08 classification 3221, they are called nursing associate professionals. This sounds all very technical, there are numbers, but to illustrate that this can cause problems, I will demonstrate with the example of Switzerland. In the year 2000, Switzerland had 12 nurses per 1,000 population. In 2017, there were 17 nurses per 1,000 population. What has happened? Was there more immigration?
Non, mais là, je pense que tu as killé l'enregistrement.
Mais c'est encore là. Ouais. Regarde, recording. Bon, on va voir ce que ça donne.
Pilar, Pilar, can you go on mute, please? We're getting some feedback, please, Pilar.
Non, ça va.
Ah non, c'est bon.
Ouais, ouais, ouais.
So what has happened? The increase from 12 nurses per 1,000 to 17 nurses per 1,000 population. There was no more immigration. There was no more education, no more nursing diplomas per year, and people did not stay longer in their profession. So there was no better retention. What happened is that healthcare assistants with some training, nursing associate professionals have been aggregated, added to the numbers of nurses. We looked with the statisticians in Switzerland to see where the problem was, and then got to the ISCO classifications, which are mainly focusing on professional activities and to a lesser extent to education. We all know that the high number of research projects have clearly demonstrated that the length, the level and the quality of nurses' education have a big influence on the quality of work. So I want to recall that nurses are highly educated professionals, and we need to have our education better reflected in OECD reports. And therefore, I think it is worthy to have a close look at the ISCO classifications. They might help, or an adjustment might help to get less confounding information. And if I recall what Jim Buchan said, it is very important to have correct workforce planning. And to have this correct workforce planning, we need the correct definitions of what is a nurse and what other health professionals or assistant people in the nursing workforce are. That was my contribution.
Well, thank you so much, Roswitha. This is another highly technical issue, the classifications, and we could do a whole webinar alone on that. And I'm sorry we don't have the time, but I think these are very valid issues you raised. That may, and I'm grateful you said, let us look at the definition and use them, because I think the problem is less with the classification systems, because these are constructs for labor force statistics, but how they are used. And as your example was great to say, how can it be that all in a sudden we have so many nurses in Switzerland, that this is a definition question, and has to be looked at, because yes, this distorts pictures on whether the workforce is sufficient or not, and sufficiently qualified. Thank you so much, Roswitha, again. And we have a last contribution from Hoishan. I hope I pronounced your name correctly, and I'm very pleased to see you speaking about decent work. So please go ahead, Hoishan.
Thank you. I hope you can all see my screen. So thank you. Thank you very much, and good morning, good afternoon, everyone. Thank you for having me to be part of this panel. It's an honor to join this panel discussion to highlight the importance of decent work for the nursing workforce, particularly in the context of COVID-19 pandemic. So our colleague Anna already have very good overview of the working conditions, and I'm just going to add a bit of more information based on the information we received from our NNAs. And my presentation will illustrate the factors related to COVID-19 that impact nurses' working condition, and discuss what more needs to be done to protect the nursing workforce, and also the importance of the Convention 149. So we know that the nursing is the largest occupational group in the health sector, accounting for 60% of the health professions. Nurses made up the majority of the healthcare workforce, have been critical to the COVID-19 response since the beginning of the pandemic, and they're at the center of making healthcare sustainable. And nurses work in a very broad spectrum of healthcare. In this pandemic, nurses are every step of the way, from testing, diagnosis, treatment, palliative care, end-of-life care, and disease prevention. And as the pandemic continues, many nurses in the course of their professional duty have contracted the virus. And unfortunately, many of them have died because they were doing their professional duty and did not always have the protective equipment and training they needed. So ICN has been working very closely with our National Nursing Association, NNAs, since the beginning of the outbreak in China. And we host webinars and talks to share useful information and learnings. We also conducted several surveys to highlight and monitor issues related to nurses' well-being during the pandemic, including personal protective equipment supply, infection prevention and control training, violence against health workforce, and also the psychological support provided to nurses. The survey result found that the pandemic has taken a heavy toll on the physical and mental well-being of nurses. And here I have listed some key findings in the survey conducted in December 2020. So you can see on the economic and well-being aspect, just about half of the NNAs report that COVID-19 is recognized as an occupational disease for healthcare workers. And in most cases, the access of healthcare workers to entitlements and compensation due to COVID-19 is highly linked to whether the virus is classified as an occupational disease. And less than half of the members report that compensation is available from their government for healthcare workers infected with COVID-19 following the exposure at work. And among the country providing the right to compensation, the eligibility of claiming the compensation varies highly across country. And even a few NNAs state that compensation only honor nurses who have died from COVID-19. And the additional occupational risk and the demand and pressure at work have led to a wide debate of wage levels and also remuneration in some countries. And we can see that about 80% of our association report mental distress among their members, burnout, isolation, anxiety, depression, and also the fear of stigma and discrimination are the common mental health issue reported to our NNAs from frontline nurses. And nurses reported feeling isolated from their family, and they are very anxious about avoiding infecting their family members with COVID-19. And some NNA have constantly received reports of nurses having increased working hours, redeployment to different hospital units, or experiencing mental distress due to the poor working condition. The survey results also revealed there is a lack of protections of nurses. At the time that we conducted the survey 4 months ago, the lack of PPE remains a huge issue in some countries. About 20% of the NNA have expressed the shortages of PPE in long-term care facility in their countries. And lastly, in the social and well-being aspect, about half of our NNA have received reports of incidents of violence or discrimination against frontline healthcare workers. For example, nurses in some countries reported discrimination or abuse related to infection, and some have encountered problems getting childcare due to their work as a nurse or midwife. So the rapid extensions of COVID-19 emphasize the urgent need for a strong health workforce as an integral part of every resilient system. However, the global nurse shortage, the lack of protection and psychosocial support, and the increased occupational risk are specific aspects that put nurses in a very vulnerable position. And the decent work deficit in some countries represents the undervaluing of nurses and the underinvestment of nursing. The occupational risk, poor working condition, and poor pay of nurses in some countries are resulting in noticeable increase in disputes and strikes. So there's a recent analysis has identified industrial disputes and strike actions in 84 countries since February 2020. And the strikes are mostly related to poor working conditions and the lack of PPE. So now we know that the COVID-19 effect is clear, but the scale of its impact on the nursing workforce is not. And in ICN recent policy brief state that there is an increasing evidence nursing are considering to leave their jobs or even quitting the profession. As our president already mentioned, due to the existing shortages problem, the aging of the nursing workforce, and also the growing effects of the COVID-19, ICN estimates up to 13 million of nurses will be needed to fill the nurse shortage gap in the future. The global nursing shortage could impact countries' ability to meet national healthcare needs in the future and negatively influence also the quality of care and patient safety. So now when we look at the Nursing Personnel Convention, is a super important instrument to clarify what decent work implied, to strengthen the rights of nursing personnel, and to guide policymakers to set decent standards of work. And there's a strong need to promote the ratification and the application of convention, because promoting the decent work in the health sector is key to increase in recruitment, development, and also the retention of the nursing workforce. In the past 1 year, the COVID-19 pandemic has raised the profile of nursing profession and provide a good opportunity to promote and review the convention. Country needs to take the opportunity to identify the gaps and also to enhance the protections of the nursing workforce, also to strengthen their support to the nursing profession. Thank you. That's all for my presentation.
Thank you very much, Hoshan. This is really an important aspect, and I think what you described is at the root of what various speakers have said is important to address, and these are the retention issues. And that retention, you know, when we say invest in health workforce employment, we don't only say invest in jobs in the health sector, but invest in decent work. And yes, it may cost money, but the benefits are so tremendous, both for the quality of care and also for patient safety and for the job satisfaction and retention in the health workforce. We are already over time, so I'm very sorry that we cannot discuss further, but I've seen a lot of communication, Howard, on the Q&A and chat, and I'm sure you and your team will capture that. So may I hand back over, thanking all the participants and panelists for this great webinar, and let me also add a note of thanks to the translators. The interpreters have always a difficult job with us talking so quickly, so thanks to everyone. Howard, over to you. Thanks.
Christiana, thank you. colleagues, I know we've tried to pack an awful lot into the last hour and a half. We could have done a webinar for each of the topics that we've covered. But I just wanted to remind you, let you know that we will be developing a paper on the Hero Fund, so watch out for that. And we will take your contributions from this webinar. We will be making a formal response to ILO about the Nursing Personnel Convention. Again, we will be using this webinar to support that submission, which will go in the next few weeks. Colleagues, all of the work, the ICN work, and much of what Hoi Shan has described is available on the website, the ICN website. Watch out, 2 days' time, our next report on the COVID effect on the nursing workforce will be published. We're looking a little bit more at education, and we're looking at some pay issues as well. So the next in our series of reports on the impact of COVID on the nursing workforce in just a couple of days' time. Madam President, let me come back to you for closing remark. Annette, over to you.
Thank you, Howard. And thank you to all the speakers, and particularly our guest speakers from the International Labour Organization and to Jim. That was very informative, and it gave us a lot to think about when we start to discuss our strategic approach to government for building resources and building capacity and retaining, and particularly retaining our current workforce. It's so important to talk about decent work, and you've given us a lot of information around what you are doing, and we'd be delighted to answer your questionnaire survey and feed into that whole process. It sounds like an excellent work, particularly when you talk about brain drain and gender and effects of COVID and access to social health care, and of course discrimination and violence. But two things I would like to say, which I was very impressed by, I think most speakers saying, and that was that it has to be an all government approach. It's a thing that I have been saying for a long time, that you cannot have a healthy workforce without all of government being involved. It's not just about health, it's about healthy people who can, you know, work in construction and transport, in agriculture, in all of the areas. And if you don't have healthy workers to work there, it doesn't work. So it has to be an all government approach. The second thing I would just like to say is resilience. I do believe that nurses have been looked at as they will care for people regardless of the challenges, regardless of what happens. But that's not going to continue because their resilience is at breaking point. I have no doubt in my mind about that, and we have to look after those nurses. The third thing I would like to say is funding. It was interesting to hear all the different aspects of funding and how we might look at all of that differently. And I think that is an issue that we need to address. In retention, different opportunities, in particular for people might be thinking of leaving, and you're talking about maybe retraining, reorganization of work, older people and people who are affected by COVID. So we have to look at different opportunities. We have to present those opportunities to government. Mobility is an interesting issue, because what I am fascinated constantly about is, particularly in high income countries, we allow our own nurses to leave and then we recruit from other countries. It makes absolutely no sense to me in whatsoever. And finally, just to thank everybody, but to say to my colleague, Dr. Dilip in India, we are with you, we do support you, and we are in solidarity with all the nurses, and anything that we can do to call on other people to support or help our governments to support, please do not hesitate to ask. Thank you. Over to you, Howard.
Yeah, and on behalf of all of us, Dilip, everybody on this call, those messages of support are with you, the nurses and the people of India. Thank you, everyone. Thank you, all our panelists. Thank you, Christiana. Thank you, ILO colleagues, for joining us. Thank you to the translators. Take care, everyone, and keep an eye on our usual channels on the website, on the social media feeds for all of the latest from us. Take care, everyone. Thank you. Goodbye.